Welcome back, everyone. Today we are diving into the deep, dark rooms of the hand, the fascial spaces. Think of the hand not just as skin and bone, but as a series of high-pressure compartments. Dr. Sarah, I'm ready to talk about why a simple pinprick can turn into a surgical emergency.
Exactly, Dr. Khan. For the boards, you have to look past the surface. We're focusing on the thenar and midpalmar spaces today. These are potential spaces, usually filled with loose connective tissue, but they become very real and very dangerous when they fill with pus.
I love that, potential spaces. It's like a balloon that's currently deflated, tucked under the floorboards of the palm. But when an infection hits, that balloon inflates with pressure. Why does this matter clinically? Because the hand is prime real estate. There is no room for swelling without something getting squashed.
Let's start with the layout. The palm is divided by a strong fibrous septum that dives deep from the palmar aponeurosis and attaches to the third metacarpal. This is high yield, students. That septum creates a border. Lateral to it is the thenar space. Medial to it is the midpalmar space.
Right, so if you have an infection in the thenar space, maybe from a puncture near the thumb or index finger, it's trapped. It sits deep to those flexor tendons and superficial to the adductor pollicis. It's like being stuck in the basement of a house, where the ceiling is the tendons and the floor is the muscle.
And if that basement fills up, where does it go? This is where the lumbrical canals come in. Dr. Khan, how do you explain those to your residents?
I call them the exit ramps. These canals surround the lumbrical muscles. They provide a direct path for infection to migrate from the deep palm out toward the fingers. It's a literal highway for bacteria.
Precisely. Now, speaking of pathways, let's talk about the synovial sheaths. The ulnar bursa is the common sheath for the flexor digitorum superficialis and profundus. High-yield point students. In about 50% of people, this ulnar bursa actually communicates with the radial bursa, the sheath for the flexor pollicis longus, at the level of the wrist.
That's huge. That means an infection in the pinky can travel up the ulnar bursa, cross over at the wrist, and end up in the thumb. We call that a horseshoe abscess. If you're the doctor of choice in the ER that night, you better be checking both sides of the hand, even if the patient only complains about one finger.
And we can't forget the pulp spaces. This is the felon, not a criminal, but a very painful infection of the fingertip. The anatomy here is unique because the pulp is divided by vertical fibrous septa that run from the skin to the bone.
It's like a honeycomb. If you get bacteria in one of those little honeycombs, the pressure skyrockets because the septa won't stretch. Why does this matter clinically? It can actually cut off the blood supply to the bone. You can lose the tip of your finger to necrosis just because of pressure.
And remember, the blood supply to the epiphany, the base of the distal phalanx, is usually safe because it branches off proximal to that high pressure zone. But the shaft, the diaphysis, is at total risk.
So we have these infections in the palm and the fingers. But Sarah, what happens if the pressure gets so high it bursts through the proximal end of those palmar spaces? Where does the pus go next?
It travels into the forearm, into a very specific clinical space called the space of Perona. This lies between the flexor digitorum profundus and the pronator quadratus. If an infection reaches here, you're no longer just dealing with a hand issue, you're dealing with a major forearm emergency.
It's all connected. It's like a series of tubes and chambers. You have to understand the walls, like that third metacarpal septum, to know where the infection is going to be contained and where it's going to leak.
Exactly. To summarize for your exams, the thenar space is lateral, the midpalmar is medial, separated by a septum on the third metacarpal. Lumbrical canals are the highways to the fingers, and the ulnar and radial bursa often communicate at the wrist.
And don't forget, a felon in the pulp space is a race against time to save the bone. Clinical anatomy isn't just about naming parts, it's about predicting where the trouble is moving. Thanks for the deep dive, Dr. Sarah.
Anytime, Dr. Khan. See you all in the next session.